Hi everyone, it's Em, and today I'm going to be talking about how I got interested into optometry. If you don't know already, I am an optometry student. I'm in my second year, and so I just wanted to get on here and talk about why I chose optometry, the other professions that I was interested in, and why you should choose optometry too if you're interested in eyes. Okay, so I wanted to start at the very beginning. I have always been interested in medicine. I've always been interested pretty much since I was 4 years old. I wanted to be a nurse, and specifically I wanted to be a baby nurse. I wanted to be the nurse that took care of babies after they were born. And so I really kept up with that dream ever since I was very little. I think I wanted to be a teacher for like 1 week, but other than that, it was always about being a baby nurse. So I continued with that dream up until I got to around middle school. I think it was 7th grade exactly. My high school did these really cool things where students could go to another school and do certifications, and that would count as part of the classes. So you'd go there to the other school for half a day and then do your normal high school classes for the other half. And so my high school did these classes, and I found out about a program called surgical technology. And immediately after that, I decided to switch to being a surgical nurse. And so I kept up with that for a while, and then I think a family member kind of mentioned she was in the medical field, and I didn't have much knowledge of what surgical nurses did. I thought that they were really a part of the surgical, they are very part of the surgical team, but I thought that they were really in as a part of the surgery, scrubbed in, everything, assisted in the surgery. But then I was told by a family member, I think, that they actually do most of the charting during the surgery. They don't scrub in, and they just assist the surgical team by bringing in equipment if there needs to be any, or handing the surgical tech equipment. That's what I found out from that family member, that's what the nurses actually do. And she suggested that if I really wanted to be part of the surgical team, that I do PA, which is physician assistant. And physician's assistants can be in lots of different specialties. They can do surgery, they can do more clinic. They are a big part of the medical world. And so I thought that that was such a good thing, because I could do surgery if we wanted to, or I could do something else. Going back to that surgical tech program, the surgical technology program, I knew that I really wanted to get into that program. That was going to be such a big stepping stone that no matter what I did, that was going to be crucial. I had my goals and my sights set on that. In order to get into that program, it was suggested by the program director to do CNA. So my junior year, I'd gotten into the CNA program at that same school that also had surgical technology. They also had the CNA program, which is Certified Nurse Assistant. And so I got into that program for my junior year, and that program was only a semester long, and I really enjoyed that program. I learned a lot. I worked at a nursing home for a while and really enjoyed getting into patient care. So like I said, the program director for the surgical technology program really suggested that I do that program, and so I went in to apply for a surgical technology program. I ended up getting into that program, and that was also such a pivotal moment to all my career choices after that. If you don't know what a surgical technologist is, basically a surgical technologist sets up for all surgical procedures. They work in lots of different capacities. They can work in hospitals, surgery centers. They do a lot. They set up for the procedure, make sure that the surgeon has everything that they need, and then they also assist during the surgery by handing instruments, getting things ready during the procedure, all that stuff. So they're really important. They make sure everything stays sterile. It was such a blessing and a joy to be able to learn all that stuff about surgery, and I loved it. I didn't know initially when I was going through that program that I was gonna like eyes, and I remember learning about the anatomy of the eye in our anatomy class, and I remember learning about different eye instruments, but I really didn't know that I was gonna like eyes. It wasn't until I got into my clinicals and even working in a hospital that I knew that I liked eyes. I finished learning about surgeries and stuff during my senior year of high school, and then after I graduated high school, that's when we started our clinicals. So I did 2 rotations of clinicals, and I did one at a surgery center, and we did a lot of cataracts there, and I really enjoyed doing cataracts. They're really fast, they're really fun, it's very intricate, and I like the instruments that you get to use on it and just the procedure itself. I also loved working with ophthalmologists that did those surgeries. They were all wonderful. My second rotation was at a children's hospital, and I loved it there. That is when I really got to do strabismus surgeries to align the eyes properly. Those are commonly done in pediatric patients because oftentimes they can have misaligned eyes that require surgery to fix it. And that was a really special thing. I learned so much from those ophthalmologists about eyes. So from that, I really knew that I liked eyes and knew that that was where I wanted to go from there. But I wasn't quite sure where to go from that point. I ended up going to finish my undergrad in Idaho. Just 5 minutes away from my apartment in Idaho was a surgical center, and it was an eye surgical center. I worked there all throughout my undergrad. We did a lot of cataract surgeries, that was our main thing. We did some glaucoma surgeries, and then we did also a lot of retina surgeries. So a lot of floaters and a lot of retinal detachments. That was amazing, and that's also when I knew I love eyes. I know I want to work in a profession that focuses on eyes. And I was also, while I was there, not only getting to work in surgery, but also got to work in the clinic that was there. And so I got to work with patients. I got to do some of the preliminary testing, which is like taking their VAs, taking their eye pressures, seeing what their complaint is about coming in. And that was really great to just know that I liked talking to patients, and I liked seeing how I could help them. Of course, that's, the doctor's job, but I liked wanting that ability to be able to help them. So I knew that I liked eyes, and I knew that I wanted to be in a profession that worked with eyes. So that came to pretty much 2 options in my mind, which was ophthalmology or optometry. Ophthalmology is eye surgeons. They do lots of eyes. They work in clinics. They assess problems. There's different specialties, but they go to medical school and then do a surgical residency after that and are able to perform eye surgeries. Optometry, on the other hand, is not going to medical school. They go to optometry school. They learn all about the eyes. They do rotation, but they do not do a surgical residency, and most places cannot perform any surgical procedures unless they are pretty minor. And so I had those 2 professions that I thought both were great. I've worked in surgery for a long time. I love eye surgery. Only thing that was kind of a con to ophthalmology was the time. It is 4 years of medical school, and then 4-ish, 5 years of residency, fellowship if you want to specialize even more. And that seemed like a long time for me. I love surgery. I love being able to work in that, but I also wanted to have something that could be more flexible with the family. I want to eventually have a family. And so optometry was something that I was really looking into. I shadowed lots of optometrists and really just fell in love with working in the clinic and thought that that is such a great profession for me. I like that you still get to do most things that an ophthalmologist gets to do as far as treating patients, just minus the surgical part of it. And to me that was great. I loved it. My goal as an optometrist is to dive deeper into eye problems and look at more of the pathologies that patients may have. That's really the reason why I chose optometry. It has so far been such a great thing. I am so happy with my decision. If you are deciding, if you know you like eyes, and if you're deciding between optometry versus ophthalmology, I love optometry. I don't feel like I am missing anything. I don't feel like I'm missing being able to do surgeries, because there is still so much that you can do as an optometrist. So if that is what you're deciding between, just know that you still get to do a lot, and it is such a great profession. I highly recommend it. Again, I'm only in my second year and I have still so much to learn, but I wouldn't change a thing. I hope you guys enjoyed this video on why I chose optometry and my perspective on this career. Again, if you like eyes and if you want to be a healthcare provider and you want to be a doctor, being able to diagnose patients and treat patients, then I think this is the right profession for you. It has so far been so great. And if you are interested in this profession, tell me why in the comments. I'd love to hear. I hope you guys have a great day. And again, if you have any questions, let me know as well. I'll see you later. Bye.